Okay.
All right. Well, hello and welcome everyone. I feel really, really lucky to be connecting across 4 time zones with 3 amazing craniosacral therapists, Dr. Kate Klemer, Mary Ganzon, and Margaret Rosenau. Did I say your last name right, Margaret?
Rosenau, yes.
Okay, thank you. They are longtime colleagues in the field of biodynamic craniosacral therapy. All 3 are teachers and practitioners, and they're writing a book together. So I couldn't think of any other way to dive into the biodynamic style than to talk with all 3 of them together. So thank you all so much for being here.
Thank you for having us.
So why don't we start with Mary? Will you go through some of the principles of biodynamic craniosacral therapy for us?
Yeah, and before I go, thanks so much for this opportunity. We're all we just love being able to hang out together, and then to get to talk about BCST, how we know it in the short form.
Awesome.
So Heather, before I go over any BCST speak in terms of vocabulary, I want to just say that actually the biggest piece that will lead us to a major principle is the paradigm shift. And that's the paradigm of that the practitioners are not there to heal you, the client, or they're not there to fix the client. So that is a major paradigm move in terms of being a body worker, being a practitioner. So, and how did we get to that paradigm shift is when I thought about the principles, I really thought about the truth. Like I looked at principle and I thought, what does principle really mean? And that it's a foundation of, if it says foundation or truth. Oh, foundation, that's what we do. What do we rest on? What is this foundation that we rest on? And the more I thought about it, the more I thought about the biggest piece is that there are forces in the body, and that there's an organizing force, and that everything that expresses is from there. So let me pause and take that in. So William Sutherland, when he was listening to all this, was first approached it from a biomechanical point of view and used biomechanical terms like flexion and ignition, neutral, like flexion. And later on in his life, when he felt this mysterious presence called breath of life, he started listening to it. And instead of imposing something on the body in terms of biomechanical work, or I'm going to hold her head this way, he started listening in a way where he saw that there was a force in there that we just had to listen to, that had an inherent health, an inherent treatment, just like we have inherent dignity. So I'm going to pause again. So when we pause, it's an opportunity for us to feel the space between us, and how that's actually BCST in process. And so when Margaret and Kate start to talk about these things, we're actually riding this wave of forces. So I would say the foundation is that there is an organizing force. And then from that, we start to see that, if you say another principle, is that we relate to the body as a whole. So that the tissues and the fluids are actually interlinked with each other. And that if I touch you on the toe, it's going to affect your head. So that's one of the ways that's another orienting foundation principle. And another piece that comes from this is that when we start looking at these forces, we see and we start perceiving that health is never lost.
So that is a really beautiful concept that is pretty foreign in Western medicine, that health is never lost. And even in some of the more Western-minded ways of approaching healing, like the fix. So could you talk a little bit more about that? This health is never lost. What does that mean?
So if we sit in something called the blueprint of that inherent health and that universal principle, we sit there, and that's all. And that the expression of Mary or Heather, the expression of my arms and my gesture is part of that force. We start to see that that there's the health is always in the system. Let me be a little more clear. So when a client comes in, and they can be coming in for many things, frozen shoulder, emotional distraught, anxiety, depression, having a hard time with aging, whatever they're coming in with. One of the ways we meet them is we do not look through the lens of pathology, that something's wrong, that needs to be fixed. So we look at that the body and the intelligence were working to manage this person's experience. And as I said that to you, I got a chill in my body, like, yeah, that is really true. That with different parts of one's life or one's injury, even, that the body is doing its best to manage what's happening. And it doesn't mean that if somebody came in and let's say I'm working with someone who's a victim of cancer, it doesn't mean that they should do other work, their other treatments. But the paradigm we sit in is that this is not pathology. And that one of the ways we have to meet any expression of the body is first with respect and appreciation. So before we even say, oh, this is where it is, and acknowledge, oh, I'm in the sacrum and this movement is happening or not movement happening, first we say, oh, thanks for letting me be part of your journey. Yeah, so the other piece to the health is never lost is one can imagine someone in pain or in distress wanting to be out of pain and distress, and that how could they respect and appreciate what's happening? We have to go through not just the meeting of the person, but also the maybe information of what is healing? What does it mean that it's working?
So, okay, right, people come, why are people going to walk in your door? Because they don't feel good, right?
Great question, yeah.
So then if that's where they're coming from, for some reason, whether it's pain, a Western diagnosis, or emotional distress, or whatever it is, so that sounds like this first thing you've got to orient to is the health underneath that pathology. Well, and you're actually saying not to identify or see the pathology as a problematic in the first place. Am I understanding that correctly?
You are saying that correctly. And there's a step before that.
Okay. What's the step?
which is actually what I really sit on in. I really sit in this in my work is, what does it mean to meet this person in presence?
Mm.
Exactly. That exact moment of that sensation right there that we all had, that how do I meet you, all of you, as you're sitting there telling me about your distress? Am I giving you space to be there? Am I already thinking, oh my gosh, what should we do first? Am I in a sense of, how's my heart relationship to what's happening? So the step before even going to their health is, what's it like to be you today? So that meeting, like, and that's one of the biggest practitioner skill number one, presence and non-judgment, and how do we meet each other? Yeah.
Right. And so then that sounds like that meeting
Yeah.
informs whatever comes next. So what then does come next?
That's a really great question. So this is a place, maybe I can start to open it up a little bit, because I know this is one of the things we talk about is in the meeting, what we call is the relational field will start to arise. And what is that? And what is that? Not just what is that, why is that important? I want to go back to that. We don't pathologize anything, and we're not here to fix you. And somebody here in distress, what's happening? What's really happening? Yeah. So as I meet you in presence, or the client in presence, and then maybe what comes next is asking them, are they comfortable? Where can they settle in their body? Maybe they can't. Maybe settling feels threatening at this moment, and we have to do something different other than letting them know where their seat is, how they're feeling, the embodiment piece. And then something will start to slow down. A rhythm will start to slow down. A presence in the space will start to arise. And this relational piece, that you and I are doing this together versus me doing something to you. Yeah.
My head just went in a lot of ways, because the first thing I think of is trauma, and how a trauma is something done to you against your choice in the first place. So this idea of coming together to do something together, co-create, where the person has agency and has their will and their choice pulled in and like acknowledged. That sounds, that just hits me as like, oh yeah, this person has been harmed in some way, and had that taken away. What a moment that is to have it given back.
Exactly. Yep.
Really well said. Absolutely. Yeah, that sense of self-agency.
Yeah.
So you sent me a couple of terms here, and I think it maybe leads through this moment. I think I understand what you mean by blueprint as what you are. And then there's imprints. I come from an Ayurvedic background, and so we have our own language for that, which would be prakriti and vikriti, or constitution and imbalance, and that dance and relationship. Can you talk about blueprint versus imprint a little bit?
Well, that blueprint is that inherent universal place, that original matrix, let's say, that before conditions. And then imprints isn't necessarily negative, it could be positive. The imprints is your experience in life. Like birthing is an imprint. What happens in your birth is an imprint. What happens when your mother picked up the phone when she should have been with you is an imprint. So, and then as you go on in life, that starts getting stacked on top of each other. Yeah, those imprints. And so how the blueprint and the imprint meet is something that happens in the session and over time. Yeah. Yeah.
And what happens as the blueprint and the imprint start to meet more and more? Like what happens in your clients?
Mm, mm. One time, my teacher, oops, excuse me. One time, my teacher, Anna Chidi, said, at the beginning, everyone feels different. Everyone is so different. She was talking about our training, our groups, and at the end, there is a sense of sameness. Now, I'm not, I want to quote this properly, is at the beginning, people are identifying with their dis-ease. And as blueprint and imprint start meeting and change starts happening, then they start identifying with that blueprint self, where they have experiences, but that they are not the experiences. Yeah.
And
Yeah.
then something happens from
And
that
happens.
space, right? Like you start to move through the world more and more from that blueprint.
Yes. Yes, you move through the world with that blueprint. And then it's not just that you move through the client moves through the world through the blueprint, but the acknowledgement of other is also happens. So when I'm in my wholeness and I've gotten myself in my wholeness, then I can see you in your wholeness.
Oh, wow. Okay. So we're talking about like a big expansion of that to, yeah, people different. I mean, everyone is different than everyone else. So say what you mean by that. I want to like pull out one more nugget.
Okay. Oh, want to definitely give my very articulate. Maybe this is a good place. This is a good place. So I have very articulate colleagues. So maybe Margaret or Kate would like to chime in on that one.
Sure.
Yeah.
I'm happy to. I always try to describe it as finding the place where you're connected and distinct. So like when the practitioner and the client are together in the blueprint place, they both know who they are individually and they're connected. And the individuality doesn't matter so much, but it's in that place, but it's not that you've merged and gone into some kind of undefined oneness. It's each person being more of who they essentially are and connected.
Yeah, it's like just being with someone with how they are, just and looking at their essence more than their maybe so much their ego or personality, but looking at kind of their root, their midline, their blueprint. Yeah. There's lots of different ways to say it.
Right. Okay, well, thank you, Mary. I think what we'll do is move then to Margaret's section. That was amazing. That was just totally amazing, Mary. So let's go into the nervous system from there.
Okay.
Mary, will you talk a little, I think, because it's, new for me, that this nervous system regulation, what can you talk to me just about nervous system regulation?
So one thing to think about in biodynamic framework or paradigm, as Mary was talking about, is that everyone has a level of nervous system regulation that also can't be lost.
Yeah.
Otherwise, they take themselves out. I mean, choosing to end your life or hurting someone else at a level where their life would end are super extreme, dysregulated places, far out on the hopefully fringe most of the time, all the time. But somewhere in there, there's a place where people continue to function. So nervous system regulation, uh, is the place where we can manage our own experience. When we're regulated, we can manage our own experience, meaning something challenging can happen and we can recover from it and move on, or we can have the energy we need to go attend to something in the moment or something difficult, and then we can settle back down and rest. We can sleep well. We don't stay. Nervous system regulation has many flavors, but it often shows up in, for example, how people sleep or don't sleep, because whatever level, like Mary mentioned, whatever level of safety there can be to settling will support nervous system regulation. And so the thing is that the nervous system knows how to regulate. It's a biological capacity that animals of all types have. And yet we live in a culture that doesn't support nervous system regulation, asks us to drink lots of coffee or work extra hard or have a lot of things on our plate that don't necessarily get resolved or deal with a lot of different things. So then that becomes the imprints or the dysregulation that can happen in the nervous system too. And so even though everybody has some level of regulation that they're capable of, they can feel far from that most of the time, or they can feel like they have to narrow their lives extremely in order to stay capable. Right? Like if someone's in chronic pain and it hurts too much to move around, you're going to create a life where you don't have to move too much. And so you can still function, but your range is really narrow. Does that make sense?
It makes so much sense. It's really interesting. Like, yeah, having to really adjust your life around a pathology.
Right. So here we are in this modality where we're trying to look at the underlying health and make that sense of health big enough that the pathology shrinks in comparison. It doesn't go necessarily away, but it's held by the health.
Wow. Okay. So I've been to a lot of school in my life, and there was this moment I had with a teacher, whose name I will not say, that was, okay, he said, sometimes it's the opposite of what you just said, and it sat with me so wrong. And so it's like, I'm loving what you're saying right now. And it was like, sometimes you just have to shrink the person's destiny. I was like, oh, what are you talking about, man? So this is quite beautifully like the opposite concept to that.
Yes.
Because instead of being like, okay, how sad is that? Like to shrink your life around what has been your, whatever the pain is,
Right.
Oh my God.
Right. But it's also, so in biodynamics, we talk about the brilliance, like Mary was saying, in any strategy. So even though that's horrible that you would have to shrink, it's also brilliant. Like, wow, you found a way to keep functioning. That's how we focus it, rather than saying, oh, look how much is wrong. We go, wow, you're still finding a way to walk around a couple hours a day. That's incredible. How amazing is that? Hey, can you remember when you could walk more easily? And as a person remembers that, because if you think about it, and in a lot of situations, people have more memory of being well especially if they're coming in with a recent injury, right? Even if that injury is really painful, they still have way more history when it didn't exist. So you ask them to orient to remember that. And then with our hands, we're tuning into that, right? We're
Okay.
tuning
With your hands, you're turning into that. What does that mean?
the health, the place that's possible to know the wellness, the part that never, okay, let me pause. I get excited.
Very
We're
exciting.
tuning in with our hands to what's well and what's never been injured.
I have this thing where when something's true, I get like a tear comes out of my eyeball, and it's happened already like 6 times. It just happened when you said that. So you're tuning in with your hands to what is well.
To what is well and has never been injured. And sometimes I think the word health is the wrong word, not the wrong, but not a always helpful word, because people tend to think of health as a commodity, like I can go to the health food store, or I can go work out. That's not the health we're talking about.
What's the health you're talking about?
We're talking about a health that is always there, doesn't need us to do anything.
Yeah. That you can really lean on and you can count on no matter what.
And in clients whose condition is very chronic, very old, where that is actually hard to remember, like somebody with something for 20 years or 30 years, what do you like? How do you remind? You guys have beautifully sent me all these notes, and this one says how the nervous system remembers. Is it the nervous system or what?
It's, well, since we're talking about the nervous system, and that's one big way where it's remembered, but we understand that it can be remembered in tissue or in bone or in fluid. It can be remembered in any layer of the body. Does anyone else want to chime in on remembering?
Organs especially, and fascial system. I mean, that's big. Fascial systems. Yeah.
Remembers health.
Remembers health. Yeah.
Yeah. And
I mean,
also remember,
the whole Fritz Pop thing is about the body communicates through the photons, through the that's a whole other thing, but photons communicate through the fascial system. So that's how that's one way the body expresses health, is through that system. They've done science research on.
Oh, cool.
And when you talk, let's say that person comes in, Heather, that you had just described, what they can always, anybody can understand, the person on the street can understand, is that health and healing arises when deep rest happens. And that I would say that happens in a BCST session. And then when that deep rest happens, then that health arises like a river coming up from underneath.
yeah,
that's
oh,
Go
go ahead.
Mary. I mean, Margaret. I have 2 aunts named Mary and Margaret, so I'm gonna like.
Do you want to go, Kate?
No, you go first.
I was going to say that when I'm working with someone who's had something going on for decades and they get some relief from it, I point that out, and then we deepen there. Like, okay, you notice it's a little bit better. Where is it a little bit better? Oh, well, my shoulders don't hurt so much. Okay, so they were at an 8 before. What are they now? They're a 6. Oh, because a little is a lot. And so you expand what's well. Doesn't matter how much. It's not quantity, it's quality. Can you feel the quality of that? And where do you feel it? And can you get the taste and the sense of that? Okay, because as far as nervous system regulation or nervous system memory, what that does is it gives the body a new experience which it can also remember, right? Even if it's fleeting, even if it's 5 minutes, it's still something that just changed the tapestry of the nervous system. You just wove in a new thread.
Mm-hmm.
Okay. And so then in this moment where you're reigniting someone's memory to that sense of healing, health, whatever, I like that you're not going to call it health personally. Like, you know, whatever that word is, whatever that thing is that's unshakable. There's this concept that you've shared with me, the pause principle. And that sounds like, will you describe that a little bit? Because it sounds like this way of bringing into the daily life 1, 2, 3, 4 times throughout the day would start accumulation of this new idea that has been remembered. It's not new, right? The old idea.
You're on it. Yeah, you're on it. So the pause principle was named that way by Ray Castellino, who was just passed away this year. End of last year. Longtime teacher of mine in the pre and perinatal field. A big person there, a wonderful human. And he started using the pause in his work with groups. But it is what you're saying. It's a pause, obviously, but it's a way of pausing with what's well, or a place to pause when things are overwhelming. So one of the things that happens is the nervous system is regulated underneath layers of dysregulation often. And if you can recognize the dysregulation and pause, that is a way to orient back to where your regulation is. So the basis of the pause principle is the permission in a group or inside yourself to call a pause when something's suddenly not feeling manageable. Or you're like, wow, I love what you just said. Can I just hang out with that? Could you say that again? So pausing when something's well, or pausing when you need an extra moment to get back on track, is actually simple, but took me years to get good at because of all the conditioning of, you know, going along and not thinking about my own needs or whatever. Like it's a really skillful way to track your own nervous system. And when you practice it several times a day, you grow your nervous system's capacity.
That's amazing. I noticed you both and that have spoken. I'm sure Kate will do it too when it's her big chunk, but have taken a moment and paused, both when we were kind of spinning out of control a little bit, you know, like there's just like conversation getting a little noodly. And as you said, the same thing where it's like, okay, let that sink in a little more. So I like that. I've always thought of that as doing it when things are wrong, but I really love this idea of doing it when things are right, because it's so much easier to feel the good and feel the where you want to go from an easy place than from a hard place. You're like banging up against whatever anxiety or whatever has like happened.
Well, and it's also like it reorients to wellness, right? Like we're used to just we don't usually give ourselves credit for what we do well. We usually spend time beating ourselves up for what we did wrong, right? So the pause is really flips that. If you can use it with like, hey, I'm pretty proud of this. Can I just hang out here before I do the next thing? Or you help a client go, wow, do you realize how different it is now from a half hour ago? Let's just hang out. What's the difference?
Can you, for the next, just, I don't know, minute or two, talk about what is hanging out with the difference? What do people have just like no idea what the heck that means and what to do. How do they do it on their own?
Oh, how to pause and hang out on your own.
Yeah.
Well, it actually means you have to meet your discomfort the first 100 times, because you'll be like, wait a minute, what am I doing? You're having to reorient. But it's really quite simple. You know what? I'm just gonna take a breath. I'm just gonna put the phone down. I'm just gonna notice where I'm sitting. I'm just gonna notice where I am. I'm just gonna pause for 30 seconds and go get a glass of water before I get to the next thing. Like any space you can make and then be with is also going to bring up whatever it is that you whatever reason you don't do that for.
Oh.
So it's juicy, but it will grow you.
Whatever reason you don't do that for.
Yeah.
You got to get through those things. Do those things, you have to like make it through that in order to get to the pause?
I can't say that it's always going to come up, but there's definitely a thing about slowing down.
Yeah.
You know, I mean, literally slowing down, not just talking about slowing down. Because your body starts to literally slow down. And I had once a student in a beginning class where she was telling a story that was incredibly activating and was I think traumatizing the room to some degree. And I kept saying, can you pause? And she literally couldn't. I had to say it 3 times. And I said, actually, I need you to stop talking. And she went, oh. And it took a little longer and she did it. But she was on such a place in her own nervous system that she couldn't even perceive how it was impacting people or how to do it any differently.
But also like what the feelings were in the story, you know, like just kind of riding over the feelings. And once you take a pause, it's like, oh, I'm upset, or I'm frustrated, or I'm sad, or this, I feel scared, you know. So that's what you're gonna uncover with a pause in the beginning, rather than kind of being aware of that when you're talking and saying like, okay, I can feel this tightening in my heart, and I feel a little, as you're talking, you can kind of, but a lot of people in my family do that, where my siblings, where they'll just yap, 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 yap. And then you'll be like, whoa, you know, they're not really feeling what they're saying, but you can just sense, you know, that there's a reason they're just talking nonstop.
I think from that was also amazing. It's kind of like you both are just very, very, very articulate about something that's incredibly difficult to articulate. So just want to acknowledge that.
Thank you.
And it makes me very excited about your book when it comes out, whenever that is. And I'd like to move from that place to Kate. And Kate, I would love you to maybe take this idea of the pause principle and some of these things and talk about how you use them in a session. So we kind of bring it back to the individual practice with people.
Yeah, in a session. Well, basically, you know, the pause principle is something you use on yourself when you're giving a session, because you're constantly noticing what you're feeling. You're kind of coming back into your own system. When you're working, you're not actually just focusing completely on the person on the table. You're actually checking in with yourself quite a bit when you're giving a session. And in a lot of ways, it's basically like taking a pause. You're taking an inventory. And especially before you start a session, you really want to have a sense before you start your day and your practice. You really want to have a sense of what space you're in. Then you walk into the room. You're going to start to feel your client's system. And so you want to be able to stay differentiated from that. And taking that pause, even when you're holding someone's shoulders or whatever, and just checking in and noticing what you're feeling in your body, in your emotions, in your energy field. All those things really are how we use it during a session. And then sometimes I teach it to patients. It's essential part of the student training. They have to learn this. And kind of help clients start to notice. I'm a chiropractor, so I'm used to using the patient word, but
Oh,
start to notice their body and start to notice, how is that for you? And those kind of questions are very similar to taking a pause. What are you noticing? What's happening for you? Um, how does that feel when you say that? You know, there's lots of different things. You always want to have kind of an open-ended question to give them space. Um, but sometimes I've literally sat down and just said, hey, this is how, we can start to learn to regulate. You can regulate your nervous system and work with some of the anxiety you experience and like take it outside of the practice and practice it in life.
okay. So it's really cool. It's like as a tool for both your practice as the practitioner and then also for the client and the student, all three.
I use it a lot when somebody's telling me a story that's overwhelming.
Hmm.
As a client, they're telling an overwhelming story. Whoa, can we pause? That was a lot of information. Wow, I can't believe that happened to you. I'm so sorry. And like,
Mhm.
they're just going, like Kate was saying, they're just kind of over here not feeling it.
Yeah, a lot of people that have been through trauma, they're telling their story, and it's so great when you can just say, wow, that was really big what you just went through, and I just want you to know that I'm right here with you, or whatever, however you like to say it. um,
Yeah.
Well, for sort of our last topic within this, will you talk a little bit more about the relational field that Mary brought up at the beginning?
yeah.
What is it?
The relational field is this right here. It's it's the space between us all and our how we're deepening in our connection. And um, I know Mary and Margaret met you just now, and they're basically the relational field is how you connect with each other. And as biodynamic cranial therapists, it's so important to do that with the support of the breath of life and sort of in the matrix of the breath of life, in the container of the breath of life. And that includes these fancy words like blueprint and um, midline and um, original matrix and all that kind of stuff. But basically, it's just how you connect with people, and that's like the core of our work, because when that safety with another being is felt, there's more settling in the nervous system, there's more co-regulation between two people, there's more connection. And when there's safety, the autonomic nervous system can settle, and then the breath of life is more palpable. Like it starts to arise and become to the forefront of the session. And Franklin's first wife, Maura Sills, has a they have a school in England, and she brought that work into in through Franklin into the biodynamic world. And it has a lot of um, footings in attachment theory. And there's a famous guy, I can't remember, that her work is rooted in with in the pre and perinatal world. But yeah, I don't know if you want to chime in on who. I think it was Winnicott. Was it?
I think it's core process psychotherapy. I can't remember the name.
Yeah.
That's the book.
I believe there is a
Oh,
book, but that's the title of the field, core process psychotherapy.
Yeah.
okay.
That's what Maura Sills school is about. Yeah.
Okay. And so I guess I'm just curious if we could integrate the idea of the nervous system regulation with that relational field. You mentioned this concept, the social nervous system. Will you share a little bit about that?
Yeah, so Stephen Porges, the guru of neuroscience and neurobiology, he basically put together like a new branch of the nervous system that I didn't have in Cairo school in 1989. And it's
What's that new
probably,
branch of the nervous
it's
system?
the social nervous system.
Oh, that is the new branch of the nervous
Yeah,
system. Oh,
yeah.
okay.
Yeah, we consider it a new branch. And so what it is it's, he really did a lot of research. And what he found out was that the vagus nerve, which has sensory and, I don't want to get too techy, but sensory and motor branches.
I think techie's great.
Okay.
If you
Okay.
want to go there, go there.
Okay. So the vagus nerve has, a sensory branch, picks up information, and it's primarily in the gut, the organs of digestion, subdiaphragmatic. And then it has motor branches. It also has sensory branches in the heart and lungs, but primarily it has motor branches there. And it is the only brake on the sympathetic, the fight flight nervous system. So that is how we actually
Brake as in like brake on a car.
brake
slowing
on a
down.
car.
Is that what you mean? Okay.
So that's actually how we slow ourselves down, is through that vagal brake, like a car brake. And he also tied it in with nerves of facial expression, the facial cranial nerve and the trigeminal nerve and the glossopharyngeal nerve and the hypoglossal. These are all nerves that, when you're a baby and you look up at your primary caretaker and she looks down at you and smiles, that that's that social nervous connection, and that's how baby learns to regulate their nervous system. That's the like original kind of imprint of regulation in their nervous system, is early, even in utero experiences. And so this work is so powerful because it is based in the relational field, safety, and creating safety. And that starts with the practitioner being able to do that with themselves and self-regulate and take those pauses we talked about. And then they kind of bring that forward into the relationship with the client and create a container of safety and settling. And that can take a long time.
I would imagine that, yeah, if the imprints or the, way of learning that as a child or an infant wasn't very positive, was that it sounds like this is a way to teach that later in life, but also, yeah, I could see how it would take a long time, like to undo or redo.
Yeah, but I think that like Mary says, the health is never lost. And so the potential of these things healing is, it's completely possible no matter what happened. And it's really important to remember that, because we can all remember all the stuff we've been through and all the things we experienced, or those feelings that we have. They come out of nowhere and we don't know where they came from, that were really early things that we might have been through. Yet when we orient to the breath of life around that, when we orient to the blueprint and that in other people, it just, brings so much good. I don't know how else to say it. I don't know if you guys want to, chime in here. I'd love it. But.
Well, we have to orient to it in ourselves in order to orient to it in someone else. So it becomes this really co-creative arriving at this place of blueprint that happens together. And so it's relational. and I learn more and more that as a practitioner, I can't pretend I'm okay. I have to be with where I am, even if that's not okay. And I can still make a relationship from there, which, for me personally is repatterning just that, right?
Mhm.
Repatterning that, like being
Like
okay
that
with
early
not being
place.
okay.
Yeah. The early place of having to be a certain way in order to be in connection.
Ah,
Yeah. Yeah. And I
And
remember too, getting an acupuncture appointment, and the acupuncturist was great. I loved her. She'd put the needles in, I'd lie there, and then she would leave and I'd never see her again. The assistant would come in and take the needles out. And a couple of times I walked out and I still had a few needles in because
oh
she
God.
didn't she didn't know where the assistant didn't know where the practitioner had put them in. And I was like, I just can't, even though I love this acupuncturist, I can't go see her anymore because I need someone that's going to like see me through the whole appointment, because that's like my little pre and perinatal imprint where I like to be, have somebody stick with me the whole time through the whole experience. And so instead of like overriding that and keep going back and having a, I just like was like, oh, that's where I'm at with this, and I'm going to go see somebody that comes in and takes the needles out after the same person who put them in. That helps me feel more supported. So that helps my relational field with that practitioner. I can settle more.
mm, mm.
That makes a lot of sense.
Mhm.
I just want to pipe in that in the relational field piece is that oftentimes, if not 100% of the time, we need the presence of another to witness our healing in terms of accurate reflection or just the presence of another, that I am seen and I'm heard. And that is also in what's happening in the relational field. And that's why we're doing it together. And that's why, I've had clients say, why can't I do this by myself? Yeah, it's
Or
relational.
clients who think we can somehow do it by ourselves. No, takes another always for everybody.
Yeah.
Beautiful. Well, what I'd like to do now is just make sure everyone listening can find you all after. So let's go in opposite order. Kate, since you were just sharing, will you just tell people how they can find you online?
Yeah, my website is divinestructure.com. It's my school name and up in Charlemont, Mass. And yeah, you can just go to that website and there's a lot of info about the training there and my practice and the work.
Great.
Okay.
Margaret?
Yeah, and I'm at schoolofinnerhealth.org, and that's my school in Denver, Colorado.
And Mary, how can people find you?
People can find me directly. So just
Okay.
to mganzon@hotmail.com. I'm in
Old
it.
school.
Yeah, well, yeah, I'm in a transition, still finding my place on this little island.
Awesome. This little island, did you say you're in Canada? Is that right?
Yeah, I'm in Canada. Yeah.
Good. Amazing. Well, this is wonderful. Thank you so much. Again, it's a miracle, I feel like, to get everybody together that fast, and really brought there's a lot of clarity and light to this kind of, very different, interesting modality, help people understand what the potential is there. Any last things you all want to share with people?
Mm. Mm.
I just want to thank you for the opportunity to share our words, Heather. Yeah.
Thank you so
Very
much.
welcome.
Yeah, thank you very much.
We'll make sure, like absolutely sure, to let everybody know when this book comes out in our network and community. And if you have, if you have trainings or anything coming up that you'd like to share, we're more than happy to kind of
Great.
interweave all of that. And I think the more the better, of all of this. So we'll just all jump in together.
Yeah.
You have a
Thank you.
training coming up, Margaret, right?
Well, actually, I may have another module 1 coming up soon, but we'll see. I'll let you know.
I got one coming up in September.
I have one coming up this fall, but I may have another opening before then. I'll send you the links, Heather, and you can.
Awesome.
Yeah.
And I'll be putting all these links and everything in a big follow-up email that everyone is going to get that attends the summit. So it's a big, fat, juicy email of everyone's contact information and everything they offer. So anyone listening in, you'll have access to all of this work. So yeah.
Great.
Okay. Well, thank you all so much.
Thank you.
Thank you.
Okay.
Thanks, Heather.
Thank you.